To be a really great physician, it requires a lot of sources of knowledge, and you are like a sponge getting all of this. And MEDtube is one of the sources that should be obligatory, I would say.
Hello, everyone. I am very excited because we have a wonderful guest yet again on our show, Wojtek. I want to just give you an opportunity to tell us a little bit about yourself and your organization, which is called MEDtube, which is very exciting for you students to listen in and share with your friends because I think that you'll really enjoy learning about MEDtube.
Okay, good to be here. Thank you for your invitation. I have the privilege to be co-founder of MEDtube. This is quite significant part of my professional life. It was founded 12 years ago, so it's not an early stage, platform or something really new. So we are pretty well established in the medical education world, of course, in digital world. Yeah, so we are 100% digital organization, and founded as let's say the story is my partners were younger transplant surgeons, and before one of the procedures they were going to have the next day, it was called the Sugura procedure, quite complex one. They realized there is no nice source for know-how they needed for the next day schedule, and it was Sugura procedure. They realized there were a bunch of journal and publications and journals and something on YouTube maybe, but it was anonymous and not credible. So they realized, well, let's do something like practical source of knowledge and know-how and skills and tips and tricks and credible information given the fact that video was getting more and more popular and easier to handle as well with multiple devices. And that was the founding, let's say, story. And I joined at the very early stage to help them with the tech part, because as you can imagine, it's more tech than medical skills were needed to launch it, right? So we are digitalizing we are calling ourselves MEDtech, which is Medical Education Technology company. We are pretty much successful, I would say, in terms of how many members have joined MEDtube, and the membership is for free. I want to emphasize it. So any professional and medicine students can join MEDtube for free. There is no subscription, and it's 5,000 new members every month in recurrently. So now we achieved 350,000 members worldwide. MEDtube there are three major regions. It's the US, Canada, it's Europe, EU5 and smaller countries too, and of course Asia. And Asia Pacific. So these major regions are the source for users, also for content. Because what I should emphasize is that the concept is that the professionals share their expertise and cases, and in the form of videos, images, documents, presentations themselves. It's not like a process in the publishing company where it takes 2 years and there's number of issues, etc. On MEDtube, of course, every piece of content is peer reviewed. It has to be approved, unlike on YouTube or Vimeo or anywhere. So it has to be medically correct and legit. But that's very pretty much based on the user-generated content. So if you are ENT professional from Toronto, let's say, we have a wonderful author from Canada, Professor Michael Hall, for instance, who published 20 books and atlases and everything, and you can find all his content on his professional profile on MEDtube. Michael Hall, if you are interested, this is a perfect example. For those, of course, who are interested in ENT, a wonderful specialty, you will see thousands of images of different cases of the ear, throat, nose area, and videos, and even ebooks. So different formats of content, and it's all available for free for medicine students and other professionals. Yeah? So I hope I gave you the big picture of what we are doing.
You did, and it sounds like a phenomenal platform. First of all, anything that's free in medicine, you should jump on it. So, listeners, you guys need to go and just sign up today. And I love that you mentioned that, yes, there are other platforms that do some medical education, but that yours is verified and you're putting out evidence based medicine that has been looked at. And it's not just, how sometimes they'll have things on platforms I won't name, but it rhymes with like sick sock, and it'll just be some random person trying to say information that's not necessarily true. So we need more fact-based things out there.
Yeah. If I can add something to this, we are partnering to many institutions and event organizers, congresses, conferences. Just this year, we were attending 6 events, like European Association for Endoscopic Surgeons or many others. And that's, of course, because they treat that as a professional platform, and that's very important for us. Yeah, that the knowledge is in those fact-checking times. It's really important to have, first of all, the curated content, and of course the authors. There's no anonymous authors. You will learn about all the content providers by name and their biography, and that's part of their educational efforts as well. They are proud of it. Yeah, we see a lot of satisfaction from the fact that they can share and educate the younger colleagues.
Mm-hmm. That definitely makes a lot of sense, and it just seems like it's the next level of community building and information sharing, because we know that students typically will share notes, or if they see like a YouTube video or something that's explaining something in a different manner outside of their syllabus. But this is more of kind of like a medical community hub for e-learning. Have you seen, in terms of like some of the medical schools and things, integrating this into some of their resources?
Yeah, we formally not so much in terms of formal, employing MEDtube to do the curriculum, but on an individual level, there are many educators and academics that are using MEDtube and sometimes asking us if they can use the specific piece of content during their lectures. They know they are referring and recommending MEDtube to their students because there is so much. It's so helpful for them. Instead of looking for content or describing something, etc., it's so easy to show them a few cases. They can also build playlists. They can also ask the students to do their homework, for instance, which is exciting. So they have to watch 5 more videos in a specific area. Let's say it's endoscopic ultrasonography, which is quite a novel technique, right? So that the students, they are better prepared next time. They can discuss how to treat the pancreas or whatever the case is. Yeah. So, and the same is for images and so on. So it's very useful. I would say that we are working with individuals more than institutions. But individuals, meaning educators and people involved somehow, physicians in any way involved in education, which is a lot, nobilitating to do education, I think, in healthcare, and some physicians prefer this even to having patients in their to seeing patients. So it's a lot of satisfaction for us that we can be providing the tools for the community to discuss also, which is very important, because around those video image cases, they can ask questions and discuss in a safe way. There is no patient allowed to the community, and they can really discuss problems that are always, some of them are controversial. What method, what device, what treatment options, and that's why there is the concilium, something that is teamwork is really important in healthcare, and we are providing space for that.
I love that. And you make a great point, as in for students who are going into their clinical rotations who may be a little bit nervous because they've never been in a surgery, they can pre look at it and kind of learn the anatomy or the way that the procedure will go so that they can ask valuable questions. They can be able to anticipate what's going to come next instead of just sitting there in awe. And it gives you a little more than just studying the anatomy in a book. You can see, you can engage, you can ask questions so that you can be prepared when you're on your clinical rotations to engage more and get the most out of it. Or if you're interested in a field where you may not be able to take the elective until later when you're about to apply for residency and you want to start learning more about it before you start shadowing or outside of shadowing, you can get more learning in that way.
Oh yeah, it's a perfect completing the shadowing perfectly, because I know about educators who are really checking if the person is familiar with MEDtube and with video content, and they are really checking the engagement of such a young doctor, and if the person is prepared to be really, for instance, neurosurgeon or any surgeon, which is really a little bit of tough because of the let's say personality. You have to have a strong head, basically, and it's stress. It's a lot of situations where decisions have to be made very quickly. So you see, to be a really great physician, it requires a lot of sources of knowledge, and you are like a sponge getting all of this. And MEDtube is one of the sources that should be obligatory, I would say. Of course, yeah, it can be anything else, but MEDtube is just providing what should be one of the pieces of the whole process that are, I believe, necessary to train a great physician, especially those invasive ones.
Absolutely. I couldn't agree more. So my question that I'm sure all of the listeners are wondering is how can they access the product?
Yeah, medtube.net is the whole thing. So you will then click to register for free. There's a quick and short registration process, and here you go. Then you can upgrade your account when you graduate your school from your school. You will be asked to provide your national provider identificator. We'll then verify that, and you will get additional features and additional options as a physician after graduation. But that's a little bit later.
That's a great point about adding the NPI number, because I was wondering earlier when you said that patients weren't necessarily allowed so that you can ask questions freely and things, but that's the way you do it. So that makes a lot of sense.
No, we don't want patients. That's the professional community, and that's the huge advantage over, I don't know, YouTube or anything else, where it's mass. It's a different language, it's a different level. So even first year medicine student is going to talk and to get involved in a much different way than any patient, without focus on being a doctor or a physician. So yeah, that's and also we are asking the really passionate people, and I believe most of the medicine students and candidates are passionate, because this is not an easy choice in life to be a doctor, but you have to be passionate, and we are inviting all those passionate people to also join MEDtube in different formats. Sometimes it's ambassador, sometimes it can be editor. We have 5 language versions, by the way. English is the first one, but also German, French, Spanish, and Polish as well. So it would be great to find some way to collaborate with us. And there are a lot of benefits for that. We have a lot of invitations for conferences, congresses all over the world, pretty much. It's quite beneficial.
That's phenomenal. Well, I love that you took the time out to share to the world about MEDtube, I'll just give you an opportunity to say goodbye to our audience.
It was great pleasure talking to you, and see you online and on MEDtube, and perhaps someday in person.
Thank you. And for all of the listeners out there, be sure to check out medtube.net. And then also, I would love for you to give us any feedback on any other guests that you'd like for us to have on, or any topics that you want us to cover. So you can reach out at Med School Coach, or you can reach out at my personal Instagram, Dr. DGram, DOCTOR, the letter DGRAM, and let us know what you want to see. See you again next week with another fantastic guest. Bye.
Thank you, Erkeda.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.